Everybody, let's get started. Good morning. Thank you to all of our participants and all of our viewers online. This is the Pitt County COVID-19 media session number 14 for April 30th, 2020. We have prepared statements from Dr. Silvernail with the Public Health Department and also a prepared statement from Pitt County Schools as well. We will do those two prepared statements and then open the floor for questions. So we'll go ahead and get started with Dr. Silvernail.
Good morning, Pitt County. I hope you are well this stormy morning. Today makes 3 complete incubation cycles, or 6 weeks, since the first case of COVID-19 was identified in Pitt County. Our data continues to show encouraging trends, and I want to share some of that with you this morning. First slide. This slide shows our Pitt County cases, number of COVID cases by date the specimen has been collected. As you can see, there's no clear pattern there. The tallest bar is 7 cases in any given day is the most that we've had come in. As you can see, the last couple of days, we've been pretty steady at about 1 case per day. Generally, our range has been 2 to 4 cases per day. This does not show the geometric spread or geometric increase that we were concerned about earlier on in this epidemic. Second slide is the same data, Pitt County cases by date of specimen collection or collected. And again, we don't see any clear pattern there. And I promise my granddaughter did not draw that graph, but it looks like something she might have. And again, no geometric spread or no geometric growth or expansion in case numbers. Next slide. This is our cumulative COVID-19 cases by date of specimen collection. While this will continue to grow and does continue to grow, the rate of growth has slowed. And I believe you can see that there is a little bit of a shoulder in that curve, and it is starting to level out. We just touched 120 cases today. And then finally, this is a slide to mostly give you some perspective on how the positive cases compare to total number of folks tested and number of negative cases. And if you look, the tall blue line is our total testing that we are aware of as being completed, which is about 1,251 or 1,251 total tests at this point. Our total negatives are 1,063. Our total positives are 120. And this just shows you the difference in comparison to the size of the number of folks who have tested negative versus the size of the number of folks who have tested positive. The small sort of purplish, at least on my screen, triangle are the pending tests, 68. I did get a verbal from my CD supervisor. Most of those have converted to negatives. We're still tracking down a few of those, and they'll be added to our afternoon run of data. And then we are stable at 2 deaths. So I think those show encouraging signs for us. Again, I want to thank you, my fellow Pitt County residents, for following our guidance, for your patience, and for your continued support in this effort. We must continue to work together to get to the other side of this epidemic. I'll run through the hard numbers of our case counts for you, for those who are not Zooming and not able to see those slides at this time. In North Carolina, as of this morning, there were 10,509 cases. In Pitt County, as I said, we are at 120 confirmed cases. Our estimated recovered from yesterday, from April 29th, was 80 persons. In North Carolina, there have been 378 deaths. In Pitt County, we are stable at 2 confirmed coronavirus deaths. The total testing, 1,251 that we are aware of. Our total positive, 120. And as a percentage of testing completed, that represents now 10.1%. So our proportion of testing that is positive continues to decline on a daily basis. And now we are at about 1 in 10 people being tested positive in our population. Negative test results are 1,063 or 89.9% of testing. And those pending 68 results, many of those will be resolved when we do our afternoon post of data. I want to touch on two other public health issues this morning. Oral health, shout out to our regular dentists, our public health dentists, our public health dental hygienists out there. We do have a dental program at the health department, which is currently suspended because of the COVID-19 crisis, but we'll be back, and we'll give you some updates when we get back. Oral health and oral hygiene are important to your overall health. Please be sure to brush and floss your teeth during this epidemic. Please make sure your children continue to brush and floss as well in these trying times. Fire safety. Some of you know I'm an old fireman too, or old firefighter too. Please be sure to check or test your smoke detectors. Many smoke detectors run on batteries, and these should be replaced periodically. In general, it is recommended that your smoke detector batteries be replaced with a time change during fall and spring. So we're just past the spring time change. Please remember, smoke detectors do save lives. Finally, please go home and stay home. And I thank you for your time this morning.
Okay, next up, we do have a prepared statement from Pitt County Schools. So Jennifer Johnson, if you are on the line,
I am.
please go ahead with your statement.
Thank you. Good afternoon, everyone. We want to continue to thank our health professionals who are helping to keep us safe during this time. We appreciate that very much. As you know, Governor Cooper did announce on Friday that North Carolina school buildings will remain closed while remote instruction will continue for the remainder of the 2019-2020 school year. While Pitt County Schools buildings will remain closed, that does not mean that instruction is not continuing. It is, and it is in full force. Again, following the state recommendations, Pitt County Schools will continue remote learning for all students K through 12 for this school year. We do realize the challenge of managing remote instruction with everyday activities during this pandemic. We want to encourage you to stay strong, to stay engaged to the absolute best of your ability, parents. Continuing to stay engaged not only continues to provide instruction for students, but it also continues the connection to school staff, to teachers, and even to fellow students. Also, it's great for engaging in a routine, and it is reflective of a community effort to really continue education of students of Pitt County during this time. We do also value parent feedback. We want to know how it's going for you. So please look for that parent survey on our website, through teacher emails that you may have received, or on our social media sites. So we do have a parent survey that's asking for some vital information from you. This is going to help us as we plan and as we move forward. Again, we want to know how you're doing, and we also want to know how we're doing as we serve the students of Pitt County. Regarding graduation, please know that we are prioritizing our seniors, the class of 2020, as we should. And we will be releasing more information about events like graduation in the coming days. We know the emotions that come with the pivotal time in a student's life, and that the wish is for all students to be able to walk across that stage. However, we are also very protective of the safety, not only of our students and families, but also of our community. Please know that we are having many conversations statewide about graduations and other activities that are part of what signifies the end of the school year. We have released a separate parent survey for our seniors and our parents, our senior parents. So please see our high school social media accounts for that, or contact the school to access that survey. Regarding grading, we are discussing grading for students at length. As you may have seen some of those state documents on our website. So please know that while our buildings may seem empty, there is much activity and meetings that are happening right now as we get guidance from the State Department of Public Instruction and from the Department of Health and Human Services, as we interpret those and as we discuss how to implement the guidance and the policies from those. We are working hard for you. We promise that. We will continue meal services throughout the rest of the school year. That has not stopped. And in fact, as of Tuesday, I believe, we have served over 400,000 meals to children in Pitt County ages 1 to 18, not just Pitt County school students. And we've provided that essential service for families across attendance lines. We are considering students without connectivity as well and internet access. So we encourage families who are not connected to stay engaged through remote learning by requesting paper packets from schools. We also encourage families to take advantage of free Wi-Fi offered by many of our community partners. For example, ECU has published parking lots and times when Wi-Fi is accessible to the general public in parking lots that maintain safe distance and measures. Also, UNC TV has excellent television programming for students in grades 4 through 8 and for high school students. For K through 3 students, we also provide a television show with the help of WNCT, which is aired on the CW, digital channel 9.2 or cable channel 6 or 106. That show is called the Eastern Carolina Education Connection, and it is brought to you by Pitt County Schools. So from 12 to 12:30 every day, enjoy one of our school meals, enjoy the TV show, and enjoy connecting with some of our teachers and principals and other staff members. Finally, we do echo the governor and the State Board of Education, their praise on Friday of the resiliency of parents, of families, of students, of teachers, principals, counselors, social workers, school nutrition workers, school psychologists, custodians, bus drivers, specialists, and many, many more people who have worked tirelessly since initial school closures on March 13th, 2020. So thank you for continuing to conquer the tremendous challenge of this health crisis that it has been for us all. And as we move forward, please remember that we are in this together, and we are Pitt County Schools Strong. Thank you.
Thank you for that statement, Jennifer. All right, we're going to go into our questions and answer session right now. We'll start with questions specifically for Dr. Silvernail, and then move to questions for all of our other community partners that are on the line. We're going to go in the order of called in. We'll have WNCT, followed by the Daily Reflector, WCTI, and we do have a Pitt County Commissioner, Mary Perkins Williams. We will ask her for questions as well. So starting off with WNCT, Ariana Kraft, are you on the line, and do you have any questions?
Hi, yes, I do.
Okay, go ahead with your questions while Dr. Silvernail comes up, please.
Okay. Good morning, Dr. Silvernail. So as we start to talk about the rephasing of, or the phasing in of reopening the state, can you just reiterate what that phasing will look like?
Well, I think we're still subject to the governor's order at this time. And he has specified specific data points that he wants to see in terms of the reopening. We are trying to mimic our data to match those requests, to match what is being published on the state website. We have one other graph that we're going to create and present. I will have that ready for the commissioners meeting on Monday, and we'll share that with at our press conference on Tuesday with y'all. I have not specifically been tasked with writing a reopening plan for Pitt County or any of the municipalities in Pitt County. We are happy to do that if at some point the governor delegates that authority back to the local municipalities and or county. But as it stands, we would be still subject to the governor's order and his reopening plan.
In your opinion, are you concerned with any kind of second spike once people start to go out a little bit more and some of the restrictions are eased and lifted?
Mm-hmm. You know, Ariana, I think it's always possible that we could have a rapid growth in cases were we to engage in group activities that will allow or facilitate the spread of the infection. I think if we continue to be mindful of our distancing from others, be mindful of our hand hygiene, and avoid large congregations, I think we could safely reopen the economy with minimal increase in the disease burden here in Pitt County.
Thank you.
You're welcome.
Okay, moving on. Daily Reflector, Ginger Livingston, do you have any questions for Dr. Silvernail specifically?
Yes, I do. Next week is hurricane preparedness week. Can you speak generally about what plans are being made to plan for a possible hurricane response in this environment of COVID-19? And specifically, is any planning underway of how to implement social distancing if a shelter has to be opened?
That's a good question, Ginger. Our sheltering plan is pretty well established and in the past has worked well for the county. An additional consideration would be, what do we do with those individuals who might be positive at the time of the storm and displaced from their home? We may need to designate a shelter as a COVID positive shelter to sort of cohort that group together. We don't necessarily have a point of service test that we could take out to a shelter, but I believe if we were in that situation where we needed to do some rapid testing, we could partner with the hospital and have some rapid testing done at a shelter to try to limit any spread within the shelter. I think myself and Randy Gentry will probably have to have some additional conversations specifically about that sheltering plan and which one might be the most appropriate to designate as a COVID shelter if that situation arose. Hopefully we are, the good Lord won't smack us with a hurricane in the midst of this too. But if one comes, we will deal with it like we have dealt with everything else that's come at us.
From your lips to God's ears, sir. I have one follow-up question about that. Are you concerned that because there has been so much emphasis at staying home and distancing yourself from people, that if God forbid we do have a hurricane, people won't seek shelter when it's needed?
Well, I think that could be a factor. We know people have not sought medical care for some conditions that they probably should have sought medical care, probably in some respect related to their perceived fear of COVID. I thought about putting some bullets into my prepared remarks this morning about perceived risk. And I don't want people to think that there isn't a risk, but probably the general public's perceived risk of COVID is greater than the actual risk of COVID. It does remain a serious infection for some members of our community, but I would remind folks that over, probably in the neighborhood of 80% of people who get the infection have a very mild to moderate illness. Only about 5% of people who get the infection require critical care, meaning ICU level of care. And then there's about 15% that needs medical care at some level, which might include up to hospitalization and supplemental oxygen. But the vast majority of folks do very well with the infection. But I think their perception is that they're at high risk for the infection and at high risk for a severe outcome with the infection, when in reality, most of us would likely experience only a mild to moderate illness if we were unlucky enough to get it.
Okay, thank you.
You're welcome.
Okay, next up from WCTI, Tyler Hardin. Do you have any questions for Dr. Silvernail?
Good morning, Dr. Silvernail. Yes, good morning, Dr. Silvernail. Pitt County obviously, has the most cases here in the East, and I was going to see if there was maybe a little bit more depth to kind of why that is. Is that because of population density or testing? Do you kind of know some of those factors?
To be honest, hi, Tyler, I haven't looked at that specifically. I mean, we are one of the largest counties in the East. Greenville is really the largest city in the East. So I think that's part of it. As you move further east, the population density generally thins out even more, and I think that provides a natural barrier to disease spread, especially for this infection. So I think that if you looked at other population density across the East, we are the population center for the most part east of I-95, and that's why we have a little higher case burden than other counties.
And as government officials, are hoping to start testing 2% of the population per month, what is needed to make that possible? And is that really realistic? And what time frame do you think that could happen?
That for Pitt County, that would be about 3,700 tests per month. So it's about 370 tests per day. We have had some talks with the North Carolina Department of Health and Human Services about standing up a mass testing site. Those plans are still somewhat in evolution, so I do not have details on those. But I would say in the very near future, we will have a mass testing site of some sort set up here with state help. We continue to see increased testing across our established medical practices that include Vitamin Medical Center, Vitamin Medical Group, ECU physicians, Physicians East, several other urgent cares in the county, as well as many private physicians' offices in the county as well. So I think if you look at that all together, we will probably hit that 370 tests per day across the county, and maybe even a little bit more. As I mentioned Tuesday, we're also working with our academic partners at ECU, Brody School of Medicine, and State Health on a prevalence survey that will have a more defined sampling strategy to be representative around the county, and that will be an ongoing study to look at the rates of both active disease and the rates of antibody positivity across the county is how it's drafted or in its early conceptual stages right now. And we expect that to probably be starting sometime next month.
Gotcha.
Well,
And as
I think we're
whether
already in probably early June. Sorry, Tyler.
oh no, you're fine. And then as the weather changes and the temperatures are getting warmer, we're going into summer. Talk a little bit about if you have any kind of information on how heat and humidity impacts the spread of the virus, and maybe what we could even look for coming into fall or the winter.
I think I mentioned on Tuesday there was a report out from the federal government late last week where they had done some work up at Fort Detrick in Maryland on studying the persistence of the virus in the environment. And the good news with warm weather and sunny weather coming is that the virus, at least on outside surfaces, would last only a matter of minutes. It's likely that the half-life of the virus on an exterior surface in the sun is about a minute to a minute and a half. So you need about 5 half-lives to clear that. So that's about 7.5 minutes to get rid of that virus on an outside surface. That's fantastic news. There's also some look at temperature and relative humidity for both with and without. With UV light, it dies very quickly with UV light. Without UV light, I think the longest time based on different relative humidities and temperatures for inside environments was found to be about an hour. So again, that we might have a 5-hour window, which is within that window that we've said before of 3 to 6 to maybe 6 to 8 hours of survival on a surface, an interior surface. So there seems to be some data coming out to support that. So I think that's encouraging as well, and that it's not as persistent in the environment as we thought, which means it's more about human to human contact than human to inanimate object contact.
Okay, awesome. Thank you.
You're welcome.
Okay, and we do have a Pitt County commissioner on the line, Mary Perkins Williams. Did you have any questions for Dr. Silvernail?
Thank you, Mike. I do have a question for Dr. Silvernail. Dr. Silvernail, some places are talking about ending the reporting of statistics. Is there a plan in North Carolina and Pitt County relating to ending the COVID statistics?
Not to my knowledge, Commissioner. The COVID-19 virus is both a nationally reportable disease and a state reportable disease. So at this point, the edict of our Secretary of Health and Human Services, it is mandatory that physicians and laboratories report that infection, and it is mandatory that local health departments track that infection. And then again, we record that data per county, forward that data to the state assembles that into a state picture by county, and then that data is shared with federal authorities at CDC and Federal Health and Human Services. So I have not heard that. I'm not sure where you heard that information, but there's no plan, to my knowledge, to stop counting cases and cease to have this as a reportable condition.
If you are ordered or told or informed that you should stop collecting such statistics, is that something we will receive as information sharing from your office or your position?
Absolutely.
Thank you.
Absolutely. I would think that's a highly unlikely occurrence, but if we were told to stop counting cases, I would pass that along. I think as the local health director, I also have the discretion to count whatever I see fit to count from an infectious disease perspective.
All right. I have other questions for other people. Thank you.
Okay, thank you.
Thank you, Dr. Silvernail. Okay, we'll now open the floor for questions from any of our other municipal or community partners that are on the line. I do quickly want to run through who those are so that everybody can be aware. We do have Pitt Community College. Of course, we also have county management, the county manager, the emergency management director are both also present with us. Along with that, we have the city of Greenville, Pitt County Schools, and Greenville Utilities. So we'll go right down the list with our media here, starting with WNCT. Ariana Kraft, do you have any questions for any of our other municipal or community partners present?
Is there a Vidant rep there today?
No, unfortunately, due to a scheduling conflict, again, Vidant is not here today as well.
Okay, no further questions. Thank you.
Okay. Ginger Livingston, the Daily Reflector, do you have any questions for any of our other participants on the line?
You said Randy was on the line? Randy Gentry?
Randy Gentry, Emergency Management Director, is actually here in person. If you have a question for him, you can go ahead with that while he comes up to the podium.
I would like to get him to address my earlier question about hurricane preparedness and COVID-19 and what plans might be put in place or trying to put in place regarding social distancing and shelters and just the overall, how will COVID-19 really change the way y'all go about planning for hurricanes this year?
Thank you for the question. Emergency management at the federal, state, and local level have been talking about this for some time now, all the way back to the beginning of the pandemic. The plans for the shelter have not been finalized, but there are several working groups that are working on that to send out guidance for all the different counties that would be affected in that sheltering process. And we'll continue to work through that, but we are in preparation mode for the season, and as it becomes available, we'll be glad to share it at that time.
Thank you.
Mhm.
Okay, Ginger, any other questions for any of the other members present?
No, thank you. I appreciate it.
Okay, Tyler Harden, WCTI, do you have any questions for any of the other members present?
No further questions. Thanks, Mike.
Okay, and we did have our Pitt County Commissioner, Mary Perkins Williams. Commissioner, did you have any questions for any of the other agencies present?
Yes, I have one for the county manager and one for the schools. For Pitt County schools, are the various schools using their broadcasting system throughout the county as to call relating to information about homeschool and what is happening for the educational methods, the messages that she gave this morning, because they have a good call out message from the various schools. And I just wonder if everyone is who's involved or would be able to get that message from the schools there.
Thank you for that question and that concern. And we agree with you that we want to get the word out to as many people as possible. And so we have asked our principals, we have asked our, we have put it on our social media. We've asked our principals to, yes, make that phone call system message contain or include information about the TV show that we are hosting, and features lots of great lessons, not just from our elementary teachers reading books, but also our PE teachers that give these kids like a wiggle break. We have our counselors also have a short counselor's corner on that TV show that really gives some social emotional advice during this time. So it's not just a fun school show. It really does have, it has educational, but it also has social emotional properties to it. And we have art lessons, science lessons. It really is a great resource. And we have asked our principals to include that in their communication with schools. Yes, ma'am.
Thank you very much.
Sure.
My next question is for County Manager Scott Elliott. I'd like to first of all say thank you to the staff in the computer department for getting my issues straight, and my son who got the microphone plugged in for me, ordered and plugged in. I want to say they have been very helpful because I've been able to do a little better with my meetings, etc. from home. Scott, my question to you is, I received some calls relating to voting. Is there voting information ready and or is needed at this time? Or what are the plans for that? Or is the director looking into it, and have you all talked about it? I'm already getting calls when I go to pick up my mail from the various boxes, the office box and the post office. I've gotten a couple of concerns and expressions. So I just thought I'd ask at this time.
Okay, am I live?
Yeah,
Yes,
look
thank you
at
for
you.
the-
I see you, Scott.
Okay, make sure I was unmuted. Yeah, very good question and very timely with the general election coming up in November. We have met with the Director of Elections, Dave Davis, and had reviewed his plans for elections and his budget. And right now, in talking to him, things are proceeding on as normal. I mean, obviously, that will be a good 4 or 5 months from now. So if that changes, he and the Board of Elections will make plans for that, and probably be more driven by the State Board of Elections than a local Pitt County Board of Elections. They'll be calling the shots in terms of any changes in terms of any alternate formats for voting. But at this point in time, we anticipate on opening the polling places and having the standard practices in place. I will say, if somebody is concerned about coming out to a polling place due to COVID concerns, even May, June, July, August, September, October, November, 6-7 months from now, you could still vote absentee. Even if you are here in Pitt County, you can choose to vote absentee and not have to go to the polling place. So that would be one option for folks who may be concerned.
Okay, that I am aware of, but there's a lot of rumor mills aired in various medias, the social medias and phone conversations as it relates to voting and what's going to happen to, I'm going to say, my vote when I decide to cast it. Will it be counted? How will I be assured that my vote will be counted? And how will I be assured that somebody doesn't take it and throw it away? I'm just sort of using some of these kind of rumor mills things that happen. I'd like this county to be ready and make sure and can be confident and can assure people that their vote will be counted. I'm already getting some of those kind of questions.
Well, I think one important thing to keep in mind is that Pitt County, along with the other 99 counties in North Carolina, uses the paper form of a ballot that then is scanned in. So we always have the backup copy of the paper form. If you use absentee, that's a paper form too. So there's really not any issues of the ballot being destroyed or lost or anything malicious done to it. So, but again, any changes in voting would be directed by the state via the North Carolina State Board of Elections. So for right now, we're anticipating things to go semi-normal as they always have, unless there was something to spike in the COVID numbers this summer or early fall. But that's about the best I can give you right now.
Okay, thank you very much. But I just wanted you and Director Davis know that there are rumors out there that people are concerned about their vote, and they are concerned that it won't be harvested and that it won't get lost in the mail, and that they need some confidence on their votes now. And
I'm sure we'll have a public media campaign to communicate to the citizens of Pitt County, those registered voters, and to assure them of the process and practices. And we'll have a little bit of time to prepare for that, but we'll address that.
Thank you very much. That will save a lot. See, I want to make sure I got all my questions and I wrote them down. Thank you very much.
You're welcome.
Commissioner, does that answer all your questions from the other?
Yes, it does.
Okay. All right. Hearing no further questions, we're going to go ahead and close this out for today. Thank you all for watching. I do want to remember there are 3 ways to get information from Pitt County. You can go to the Pitt County website at pittcountync.gov/coronavirus. You can also call the hotline at 252-902-2300, or or you can also fill out an information request form at pittcountync.gov/COVID-info. Our next media session will be number 15, and that will be on Tuesday, May the 5th at 11:30 a.m. So fun Cinco de Mayo festivities ahead for that. Thank you all for watching and have a good day.